You're listening to Maximum Medicine Radio with host Doc Martin. Stay tuned in or call in. You won't want to miss what's happening next. How do you step into your maximum potential? How do you connect your spiritual drive with your physical path? Stick around as Doc Martin takes listeners on a journey through the seen and unseen, the accepted and the unbelievable. Get ready to meet the maximum you the world needs on Maximum Medicine Radio with Doc Martin now. Hi, everybody. I'm Doc Martin on Maximum Medicine, and I'm happy to have you meet my guest tonight, and I'll tell you a story about him in just a minute. This is Dr. Kevin McCarthy, and he is a chiropractor, and I'll save the juicy story for just a minute. But Kevin, hi, thanks so much for being here.
Hey, how's it going, Sharon?
It's exciting.
Yeah, I've never done this, so I'm excited.
Good. All right. So it's going to be, we'll just spend an hour chatting. So for the listeners, you know how I always say that, sometimes if you're quiet enough and you hear the whispers of spirit, God, your higher self, whatever you call it, then you take action and something often happens that is magical. Well, I have a puppy. His name is Kiz, short for Kismet. It's a whole different story of how I got him. My brother was going to get him. I picked the puppy out of the litter. My brother lives farther away, so I kept tabs on the puppy, thought he was wonderful. My brother took him and it didn't fit the lifestyle. So I kind of knew that the puppy was going to end up at my house. And because of that, my brother had named him King. That's not exactly a thrilling name for my liking. But I said, getting this puppy is Kismet, which kind of means what was meant to be is going to happen. So I named him Kiz. Well, somewhere along the line of, I guess he was perhaps 5 months old, he tumbled around with my Australian Shepherd and went lame in the left front leg. And you guys probably also know me. I am an animal girl. I am a nature girl. And if my animals hurt, I'm beside myself. I don't have children, so maybe this is my child. So he went lame and instantly, almost like his whole leg was paralyzed, and I was flipping out. Then it got a little better, but he was tender, and you could tell he hurts, and he turned his head, and he hurt, and he cried. And all night long, if he turned over, he'd cry. Well, I couldn't get a vet appointment soon enough. So the vet checks him out and says, well, he hurts on that side because he has an ear infection. And I said, no, you don't go lame in your arm but okay, he has an ear infection. I'll treat the ear infection. And he's a little tender in his neck, so just keep him quiet. Well, Kevin, you can't keep a 5-month-old. Anyway, so he's in his crate during the day when I'm at work, and then he walks on a leash, but he's miserable and he's in pain, and I have multiple vet visits. Finally, we're on, and they said, okay, well, it might be in his neck. It might be this. Dogs get this weirdo thing where their bones all get inflamed, and it's a scary disease. I said, no, this happened when he tumbled. The other dog was too rough with him. So next thing we know, he's on a pain medicine that I give to people who have pinched nerves in their back. That stuff knocks you out. It makes you groggy. It makes you a little confused in the head. Well, Kizzy was sluggish and it didn't act like a puppy. I couldn't stand it. So I'm at my wit's end. Now I live in South Central Pennsylvania, which is right on the Maryland line. And I get on, something says, okay, here comes spirit. I am beside myself. I have no answers. The vet is giving me stuff that Kizzy does not feel better. He hurts all the time. So I get open on Google, and I am searching animal chiropractor. I'm like, where in the heck is an animal chiropractor? I will drive anywhere. And all of a sudden, I land on this page where there is a human chiropractor who also does animals. And so I'm like, okay, when that drive is about an hour and 45, I don't care. So there I'm going to go and I open the web page and there is this smiling face and I make an appointment. And Kevin, I'm going to embarrass you here for just a minute, but you can handle it,
All
okay?
right.
I need to talk you up. I go and his office is there's a great big animal emergency hospital facility. So he has an office there for the animal chiropractic. And there, I mean, I used to be a vet tech way long ago. There are surgeries and dogs in the kennels and places, intubation, that means tube down your throat to breathe. I'm like, this place is what's a big hospital? Lenox Hospital in Manhattan, something, Cedars-Sinai in LA. This place is like, I'm like, oh, anyway. And out from the room that we're going to go into comes this beaming face, happy, energized, full of light, full of happiness to be of service. I could feel it. Kevin, if I'm embarrassing you, just plug your ears.
No, it's okay.
I have to talk you up.
Yeah.
Anyway, and I go in there and he's going to think Kevin doesn't always do this kind of stuff we do in our show. So he doesn't go to the woo woo. But I felt I was in the presence of magic. I could sense his intuition immediately. I could feel his light. And he touched Kizzy. Now, many of you have gone to the chiropractor, and many of you know the old school chiropractor. You torque somebody and you high vibration push them, and he's like feathers on Kizzy's back. And he says, let me just, I'll do my thing. I'm going to figure it out, and then I'll tell you what I find. So he tells me his shoulder's out. Little push. I'm not kidding you guys. Thumb moves half an inch at the most. And Kizzy's moving his shoulder again. And we get home, and Kizzy is happy. He's moving around. He is the happiest puppy he has literally been in 2 months. So I thought to myself, even if Kevin thinks I'm a crazy person, I am going to tell him that I sense his magic. And when I said to him, will you be on my radio show? He said, well, I knew you were going to ask me.
I did.
So Kevin McCarthy, then I went to him as a human, as for me, he's a human chiropractor. And I wanted you guys to know what it's like to talk to a healer who feels the flow. And that's what we're going to talk about tonight. So, Kevin, I'm so happy you're here. I
Yeah,
want
thank
to
you.
know how you ended up. I mean, how does somebody well, first, how did you become a chiropractor to begin with?
Yeah, so I'm from Canada originally, and my family, they were just all hard workers. So all the men, there was like three generations, and you had three options. You were a truck driver, a farmer, or a steel worker. It was like rural Canada. And I had done farming and steel worker, but I kind of just kept going to school, and everyone was like, "What's this guy doing?" Usually, they're done like by the 10th grade, and I don't know. I just thought it was fun and interesting, and I kept learning about the body. And I was always into sports, and I injured my leg, and I went to this chiropractor, and he he was having fun. Like he wasn't working. He was he hugged everybody when they left, and he was just happy to help everybody. And he did this applied kinesiology stuff on me, and I'd never knew what that was. And then he literally fixed it in 5 minutes, like it was nothing. And I just sat in my car, and I was like, I can't unsee that. So I drove to the teacher's college. I was going to be a teacher at the time, and I dropped out. Like after he worked on me, I dropped out of school. And then the next day, I went to apply to chiropractic school, and the school was on strike in Canada. So then I was like, oh, I'll just go somewhere else. So I ended up going to New York. And then I met my wife, who's from Williamsport, Pennsylvania, and then went to Penn State. And because of the applied kinesiology part that we got trained in, it's such a rare thing. Like, we were the only two out of our whole class that got certified and practiced this way. And so when I was looking for a job in Pennsylvania, I just called all 20 doctors that were licensed in it and asked for a job for both of us. So that's how I ended up here. We found the best fit for us, and we got to work. We worked together. We've always worked together.
And so tell everybody what applied kinesiology is.
Yeah. So it's basically every discipline that you can think of that you can just unlimitedly add to the umbrella of chiropractic. So it's kind of three, it's like a triangle. So it's the physical, structural, then the biochemical, so like hormones, digestion, things like that. And then the third one, which I'm really getting into, obviously, and you're going to help me, is the mental and emotional part. So I've got licensed in NET, which is neurological emotional technique. But what I've learned is that every physical condition has a emotional component that if you don't address it, you're not fixing the whole. So I've really been intrigued in that the last couple of years.
So I have a really, really good girlfriend. She's also my spiritual coach, who's a chiropractor. I met her about maybe 5 or 6 years ago, and she's trained in network spinal analysis, which is another way of
Mm-hmm.
sensing the body, but not just through manipulation, but seeing the flow in the physical organism.
Yeah.
And that your neurologic emotional technique sounds like tap. Is it like tapping?
A lot of my patients do tapping on their own, and I've read books on it. It's similar, like there's some acupuncture points that are similar, but uh, there's so many different techniques and they're all good. It's just which one works for you.
Mhm.
Yeah.
And then what I've learned from my friend, Dr. Georgia, is, and she sees, as a healer, she sees things through a different way than I've ever seen. I've always been more brain, intellect,
Mm-hmm.
headspace oriented until I did shamanic training. And then got more into the intuitive and sensing things. But she brings every part of healing back to your autonomy. I'm using my words. She might not say this. Your autonomy in the body.
Mm-hmm.
Everything is brought back to the body.
Yeah.
And, big picture, you can sort of, imagine that, or that makes complete sense. All New Age spirituality often says we are a spiritual being in a human body. We are in a unique position to occupy this human form. But
Mm-hmm.
she brings her healing always back, her awareness, the processing of your illness, everything back, as I think you do.
Yeah. I just, I do. And I think I told you your last visit when I was with you.
Mhm.
When I first meet somebody, I picture them already better. Like I just put that energy into them that whatever they came in complaining about, in my brain, it's already better. Like I'm already at the end and I'm just working backwards. And I'm just trying to get them to believe in themselves enough to like take the steps they need to get there. So that's how I think.
So I love that you're saying this. So this may feel a little bit like I'm digressing, but I think it's important. I have spent the last couple of years on this show exploring how healers work.
Mm-hmm.
What is it that they do? What is the space they enter? What is the belief they hold? What is the energy they hold? And just try to pick that apart, mostly because I want to learn about it. And I have seen over and over that, first of all, I had a guest on who's an expert in consciousness. He studied meditation since, he's probably 50 years ago. And everything that he does in terms of manifesting or creating an outcome is about belief, intention, and spirit. Then someone else will say to me, well, I just know that there is an original state that the person would work in naturally if something hadn't gone wrong. And that's the just as you say, that's the image I hold.
Hmm.
It's
Yeah.
and tell me more about that.
I just, I mean, I spent many years trying to learn pathologies and like labeling things. And I'm at a point now where I continue to learn about how the body's interconnected. But
Hmm.
I don't really care what you call it at this point. I try to listen to you and then hear what you're saying. And then I try to remove stress and then I feed what's weak and then I get out of the way. The body and the person, I try to give them hope and inspiration to like be willing to go through the process. If people just come in and they're like, fix me, or no one's been able to fix me, so good luck. Those patients, they're not ready. So you have to like encourage them to get ready to
Hmm.
be better.
Hmm.
Otherwise it's just a temporary fix and they're not actually getting to the root of it.
So I was thinking about the next book I'm going to write. And um, it started out being that it was going to be the healing encounter, but over and over, has been very, very clear to me is that, and I see this in my patient population, if the patient does not believe that they can have a life without this illness because their mother had it
Yeah.
or their grandmother had it, that, everybody has, all the women in our family has gallbladder disease
Yeah.
or, you know, and I'm like,
Yeah. Me too.
so, um, and if they do not believe, it doesn't matter what medicine I give them, it will not happen.
Yeah.
And
Yeah.
then the alternative is people can have the worst cancer and things that naturally you think, in 6 months you'll be dead. And they'll be, nope, I'm
Mhm.
fine.
Yeah.
And they keep going and they beat all the odds.
Yeah.
Um,
The mind is a powerful thing.
and what I think, and you said something else important. And let me see if I can remember how you said it. You see the person already well, and then
Mhm.
your job is sort of the coach to get them to jump on the same train you're on.
I just want them to have hope. Like a lot of times people will come in and like, well, you're my last ditch effort. I've tried everybody else. And if they don't have hope that they can get there, then we have to start there.
Hmm. Hmm.
So
And then you said something else. Let me see if I can. You said I get out of the way. There's a little piece in there where you see the healed, you
yeah.
offer them the things, and then you said, and there's that space right there in that process where you've put in your talent,
Hmm.
and then you said, and I get out of the way. Well, what's happening in that space? Like, how do you see that space spiritually, physically, energetically?
I want them to sit in their car after I worked on them and just figure out what just happened and then be excited about the future. Like I just want them to be excited about the process of them helping themselves because I can help them in the moment, but if I remove all this stress and I give them all these whole food supplements and I teach them how to do this and then they don't do anything and they just eat potato chips on a couch and then they come in a month later and they're like, yeah, you didn't get it, then it's like, well, you didn't get it. So I
Mhm.
try to encourage them that they're their own best doctor. So a lot of like just to keep it basic for people, I tell them that you're the best or worst doctor you ever had. So you either, get enough rest, you eat real food, drink water, and you move around outside with people you love. If you do those things, you will chunk stress off your pile. and you will heal at a faster rate if you just do those things.
In that space where you set, and I'm going to put my new age words on it, where you as the practitioner set the intention, because in your mind you see them as well. That's your intention.
Mm-hmm.
And then you get out of the way. So that space to me is a very powerful energetic of the healing encounter. And I had a guest on, it was end of last summer, I think. She's from Australia. She has a gift where she can see, I'm going to use my words because she would say it differently. She works with doctors, so everything is sort of talked about in a subconscious versus conscious, and then the subconscious comes out. Anyway, to me, I would say it in an energetic way. She sees the wound,
Mm-hmm.
shows and tells the person what she sees, which and she's psychic at that moment because no, they've never told her that. They never, And then she said something happens and miraculously they are healed. And I think what's happening there is it's like a reminder to your deepest self, and I believe that that self is connected to God, spirit, that you are already, that your original template, again, my words, your basic construction is to be well.
Mm-hmm. Yeah.
And if we can hold that space for somebody where they even get a smidgen of a sense of it, as which she does by pointing out to them, listen, this happened to you. Basically, let's just say it out loud and let it go. You said, I do these things, show them what actually changed in their body so they can revel in it, step back, let it go.
Mm-hmm.
That space is, to me, is a very powerful space. And I think I'm going to put my spin on it. That's where God lives. That's
Mm-hmm.
where spirit works.
Yeah,
That's where the magic is.
I agree. I agree.
And I'm really trying to suss this out because, and again, I'm having my acquaintance slash friend come back on and talk about consciousness because when we, and he talks about the quantum, when we put our intention to link up with the universal field, which is what I call God,
Mm-hmm.
that is the space with which you, I'll use the word download, you manifest a new reality.
Mm-hmm. Yeah, I
That's
agree with that.
that's a pretty cool place.
It's awesome. It's awesome. That's why the longer I do this, I'm I feel like I'm like people have like jobs that they do. Like I'm not working.
You're not working, no.
I just show up to a place and like help people, and then I learn from them, and then they help me, and it's just like an interaction of like friends. Like I don't consider it a job. I mean I've I've never had a sick day in my whole life. Like I've always enjoyed whatever I was doing. When I was working on the farm, I enjoyed it. When I worked in the steel mill, I enjoyed it. I just enjoy life. And I think I didn't tell you this, but I'll tell you this on here.
Okay.
When I was 12, I was hit by a truck taking out the garbage. And I woke up 3 weeks later and I had 11 tubes in me. And they said if I was an adult or if I was overweight, I would have died. But I I didn't know anything. I was just a kid. But I was in the ICU for 6 weeks and I healed so fast because I just wanted to go outside and play again like I did. And I didn't know how long it took for things like broken ribs to heal and like punctured spleen to heal. And like I didn't know any of that. The only thing I did not hurt was my brain and my heart. Those are the only, everything else was banged up. And that's the reason my sister became a nurse because she was like, "Man, this is amazing." And it happened like in July, and I went to school in September and just acted like nothing happened. I just pretended I had a normal summer and I played every sport. And so I've always been like the optimistic old person in a little kid's body. I've just always been like that. So I don't know. I think it's just in me to share.
It took me a long time, and I think I've said this on a show previously, so forgive me anybody's listening and I'm repeating myself. I would go to shaman training and intuitive and spiritual training that I yearned for. And there were so many people in my classmates who were tripping off in a meditation or, touching fairies and angels, and it wasn't second nature to me. And I thought, I am literally I'm trudging through the swamp being a physician. It's hard work. People have heavy energy. It's hard work. I
Yeah.
don't want to do this. I want to go just be an intuitive and be a shaman and, you know, and God said, well, maybe you want to, but ain't happening. And it hit a point, and it was a couple of years ago, and I don't know what actually changed, what it changed, but I realized that I'm really good at this
Yeah.
and that I can, in my own little microcosm, change the world in my microcosm.
Hmm.
And then I realized that every time I go to work, even when it's heavy, I said to myself, oh, I think it was when I interviewed Stefan Schwartz, who is a futurist, and he talked about well-being. If every day, every choice you make, you pick the one that promotes well-being, that's how we create a new world. So I said, well, I'm going to try that. That was about May, I think, when I interviewed him a couple years ago. I'm going to try that at work.
Yeah.
Even when the person was the biggest grouch, nothing you could do, nothing was right. He didn't like the medicine. Every medicine I gave him didn't work, but how come I'm not fixing him? And it goes on and on and on. And you want to say, why are you here? So I started saying, I don't understand what you want from me because you won't do anything I tell you to do.
Yeah.
And then I said, I'm going to change. And, you'd leave there and you'd be exhausted and it would be heavy. And I thought every single visit, I'm going to find one thing good to promote in that person, even if they're a difficult personality, to compliment them on the fact that they even came in. Thank you so much for coming here after being gone for 2 years. And now your blood pressure is out of control. Your diabetes is out of control. Why in the hell did you take so long to get here? But just, I'm so glad you came here. It's so good that you're taking care of this. When I started doing that,
Hmm.
everything shifted. It was like playing, like
Yeah.
you do, you play in life.
Yep.
And I realized, and then I kind of in my meditation, God, spirit, whatever, I said, I can see why I didn't go and do other kinds of healing work. This is where I'm supposed to be. When you're in that path of service, where you're supposed to be, things flow.
Yeah. Yeah. And I think you can help more people by staying in the medical field and doing what you're doing. You can see more, you can affect more lives if you stay there.
Well, I better because I spent a lot of time in school.
Yeah.
I went into debt and, but I do have a science brain. I
Hmm.
was a PhD researcher and I taught at medical school at Emory University. And so my brain likes that kind of factual stuff. Um, But when I realized, so I better stay there because I trained in it. But when I realized that I could make every encounter a pleasure
Hmm.
by offering something of myself, of offering what I could do and at least let them feel good about something when they leave.
Yeah.
Because face it, nobody wants to go to the doctor. You're sick of the copay, you're sick of health insurance, you're sick of the cost of prescriptions, and you haven't learned yet how to eat the right foods, how to take the right supplements. So I'm kind of basically, I'm pulling you back from the edge of the cliff. And
Yeah.
then when you get good enough, then you can go see Dr. Kevin, and then he can put you on the path to real health. But I realized that that's what I'm good at. So
Mhm.
of course God kept me here, you
Yeah.
know?
Yeah.
It's the
Everyone has a
flow of
role.
life.
Yeah. I like it.
We have probably about, I'm going to say 12, 15 minutes left. I want to hear I sensed from the minute, well, first of all, your face was happy and so excited you were ready to play. And Kizzy was like the best play toy ever. You were so excited.
Yeah.
But and I mean this, when I let the listeners know, even if I sound a little too woo-woo, I sensed the magic. I sensed, and in that way, I mean the energy of play and transformation and how things can alchemically poof and be well. I sensed that the minute I met you. And then I said to you, do you float in magic? And you're like, this chick's a little weird. Um, but you told me, well, I've always been intuitive. So tell me how you use your intuition when you first sense a person and then when you feel their body and tell me about that.
Yeah. So I think the biggest thing is uh if you have to be a good listener, because the more you learn about like everything that can go wrong in the body, you have all that filed in your head, and then they will start talking or moving in a certain way or sitting in a certain way, and the answer just jumps in my head. So like they will indirectly tell me, this is what I need you to fix today. And if I just listen, they will tell me. And if they don't right away, I will ask like general questions just to open it up and encourage them to elaborate. And if I'm listening, they will like it happens all the time. I see like 15 people a day, and I just listen for the first part, and they will tell me. And every patient is different, and it's fun because my wife does the same thing, and
Mhm.
so it was kind of fun at the beginning because we sat in the same classrooms and did all the same everything, same seminars and everything. And but our brains are different. And so she would intuitively start somewhere else than I would. But her patients get better and my patients get better. And we used to debate on like who was right. And then I realized that we just have different frequencies and energies with our patients. And so when she gels with them, it's different than when I gel with the same patient. So I just stopped comparing. I was like, if you do up, I'll do down and it'll be fine. Because it's just,
Mhm.
it is what it is. It's just healing energy, and it's just how it bounces in between the two people.
And then when you lay hands on somebody,
Yeah.
what do you feel both in the diagnosis? I'm breaking it into segments. The
Yeah.
diagnosis versus the fix.
So I just put my hands on people and then I just feel differences from side to side or front to back. I can feel tone. Like if you touch a desk, it's hard versus a spongy cushion. That's a dramatic example, but I can feel tone differences and I can feel heat differences. So if something's inflamed, it's warmer. There's more blood there. So I can feel stagnation. I can just feel it. Or certain patients that are really stuck, when I put my hand on like a hip that's out of place, I will get like a wave of heat up my arms. And I never knew what that was until I worked with energy people. And they're like, oh, you're kind of doing like a form of Reiki. And so I got licensed in Reiki because I didn't know what that was. So I just I feel stuff and I don't know where it comes from, to be honest, but I feel like everybody has it in them. It's just if you're quiet enough, you can notice it. So I tend to notice it.
I used to think that I was all an intellectual, well, that certainly was my forte growing up. I'm a classic student, teacher's pet kind of thing. And then I started doing shamanic training and everything was sensing energy. And I'm like, what the heck? Um, but I realized, and especially we just did our practices and we got to work with our classmates. And then um, I put aside my intellectual head and I said, okay, you just go sit over there on the couch and wait for me and I'll be back. Um, and stuff would start to come. Now, my mom and her mom were very psychic growing up, like known to be like, okay, well, don't even think about the Christmas present that you bought in August and you put up high in the closet. If you think about, don't even mention it, don't ever, she'd know it every time. Um, but I began to see that I could sense things, and we had some practices to do that. But by putting aside my intel, I think we all have the ability, by the way.
Mm-hmm.
If you put aside that overriding control freak part of your brain and just really feel what comes to you, or just be brave enough to say the first thing that comes to you. Don't censor it, don't limit it. And now what I find, what I'm really good at, maybe this comes, my mom, besides being an amazing psychic and generous and warm person, she was also troubled and an alcoholic and bipolar. And I realized that I was very, very good at sensing when
Mm-hmm.
the ship was about to crash into the rocks.
Yeah.
And my siblings think I'm a wacko, that I see everything through the lens of depression. I probably, I'm really good at seeing when the emotional thing is when the egg's gonna crack.
Yeah.
So I see that in my patients today because we'll be talking about something and they'll be coming in because they'll want some kind of medicine unrelated to anything emotional. And they're going on, and all of a sudden I'll just stop because I'll get a feeling and I'll say, that's a lot of stress. I said, how's your mood holding up?
Mm-hmm.
And they'll say, my mood, kind of like, what are you talking about? I'm not here for my mood. I'm here for my thyroid medicine.
Yeah.
I said, are you depressed? And they'll start crying.
Yeah. What I do is I'll walk in the room and I say, how are you? And sometimes they'll say, good, but I don't believe them. So I'll say, how are you? And then they cry. And uh, Kelly will say, how do you know that they're going to cry? And I say, I don't. I just know that they're not telling the truth. They're saying I'm fine, but they're not. So they can fake it for one ask, but if I ask them again right away, it catches them off guard and they're in trouble.
Yeah, and
Can't hide it.
I describe that as I know. I'm good at picking up when the inside doesn't match the outside.
Yeah.
I can feel I can feel that discordance. It's like chalk on a blackboard. It's like sandpaper on my skin. I know
Mm-hmm.
when, and sometimes I had this patient a couple weeks ago. Man, he was cranky. I mean, he was cranky. And finally I just stopped and I said to him, I said, let's talk about it. You seem irritated today. How come? What happened?
Yeah.
And then out comes his fear of, was father died, in a medical encounter, or because the doctor didn't find something and he has to be here. But here he was just being total, actually was a total jerk. Um, and I kind of wanted to say, okay, buddy,
Yeah.
okay, you're here in my, you don't, and instead I just was like, okay, let's talk about so what happened? How come you're so cranky today?
Yeah. And
Oh,
that's
no.
what you needed. There's
Mhm.
some patients where I hardly work on them. I just talk to them and then they walk out and they're like, they tell Sharon, they're like, I feel amazing. He did great. And I was like, I don't even, I feel guilty. They should just get a free visit, but I hardly touched them. But I was just talking it out with them.
When you feel the difference in something, or can you feel the person's energy flow in their body?
Yeah. So I do muscle testing. And so when I find something, uh, sometimes you have to challenge it to see which way you have to fix it. And even before I test the muscle, I know, but I don't tell them. And some people that are like really in tune, I'll tell them, and they'll tell me. They're like, this one's going to be weak, this one's going to be strong. As soon as I challenge, like I put a challenge into the body, and then we test something that's distant away from that part of the body. And if the brain is preoccupied with the problem, it there's a delay in its response time to the second thing that you test. That's what muscle testing is. There's just a delay in the brain's response time. And
Mhm.
so, but I mean, there is energetic to it, but like a lot of times I don't even have to muscle test. I'll just, my regular patients, I'll just kind of, I'll flinch like, oh yeah, it has to go this way. And we just kind of chuckle about it because we both sense it. So,
Mhm.
but then there's other people that you have to check. They're just not as aware of their body. So
Mhm.
you have to test them, and they want to see it change. So you have to show them the change and then say, this is the way because we just saw this. And so I can't skip that step with those people.
So, what have you found in terms of doing chiropractic on animals? What are the differences and what are similar?
Mm, I always say adjusting a dog is like adjusting a toddler because they can't tell you what's wrong with them really. And then the parent is always interjecting and saying, well, this is what's wrong with them. And that's
Mhm.
what pet owners do. They tell you what to fix on their dog. And so uh a lot of, I mean,
Did I do that?
no, you didn't. You didn't.
Okay, good.
But
Right answer, right answer.
I know, right? No, but I just kind of, it's all nonverbal to begin with, and then like watching how a dog carries itself, or like where how the tail is, or how the ears are, how the eyes are. Um, you just pick up on it, and I've always been like that with animals. I've always sensed whether they were happy or sad, and um, it's like adjusting a toddler is what I would say for a
Mhm.
human because they don't tell you what's wrong with them either, and you
Mhm.
have to kind of feel it out and figure it out. But
Well,
that's
one
kind
thing that I realized, I know when something's off with my animals. I mean,
of, mhm.
I really know.
Yeah,
I've always been connected to animals growing up. I wanted to be a vet.
yeah.
That
You're a
was
vet
my,
tech.
yeah. And then I wanted to be a vet really badly, and I stumbled into being a doctor. And I can feel, I just know when something's off.
Hmm.
And that's why it was so frustrating for literally 2 months. Um, and we're off on some tangent, and I'm like, wait, let's go back to the fact his whole arm went limp, it went paralyzed for we have to go back to that fact. And um, so, but what I loved about your touch, and that's what I think is the magic about your healing, is how it was so light.
Hmm. Well, the nervous system and the body is very sensitive. So uh, I'm looking for reactions when I work with people and animals. So uh, the lighter I am, the more accurate information I get. If I push hard and am aggressive, I'm going to get a certain response. But if I'm gentle and I get a response, then I know it's a true response. I'm not I'm not adding discomfort, which will give a reaction. I'm just getting a true response. So I'm very light. with people and with animals, but I just find that my hands feel more when the body is relaxed. So if I'm gentle, they're relaxed and I feel more than if they're tense and, you know, it hides imbalances better if the person's tense versus if they're relaxed. I can get deeper.
Mhm.
So
So, do you have things like what are some of your, you probably see this over and over in people. So what are some of your guidelines to better health? Your basic things that you see that everybody needs to shift or try or do.
yeah, I think I said it earlier about the best doctor that you've ever had. So if you get enough rest, like between 6 and 9 hours of sleep. So if you get less than 6 or more than 9 hours of sleep a night, I've been told, that your body's inflamed for 24 hours after that. So sleep is important. Um, Eating real food. I don't eat a lot of food, but the food that I do eat is like very good for my body. So I don't eat a lot during a day, but I'm always full of energy. Um, and so that's important. Drinking water is important, clean water, and then getting outside, even though it's cold out right now. Getting outside and being around people is super important to me and my patients. I read an article one time, and it was the people that were 100 years old, and they did the determining factors of like what was common in those people, and the top three things were all um, like interpersonal. So whether your family was close or you were part of a community, and the number one important thing was how many social interactions you have with other people during that day. So Kelly always jokes, she's like, "You're going to live to 100 because I talk to everybody. We could go anywhere." And she's like, "Who's that?" I go, "I don't know. They are looking at me." And I say hi to everybody all the
Uh-huh.
time. So she jokes that I'm going to live forever because I do that. But
And we do have a crisis of isolation and loneliness in this country right now.
yeah, and I'm terrible with tech stuff. I was all nervous this wasn't going to work, but I'm not a techie person, so like I would rather go visit you than text you or call you. I'm like old school.
Mhm.
So, yeah.
Well, back to the sleep, because I wish more people would help themselves. We're so push, 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 and people will get a cold and they should take the day off of work and stay home and rest and sleep. Now, I have a lot of patients who their job doesn't give them sick time, so they lose money if they stay home.
Right.
But even so, at nighttime, they don't shut the TV off, so they stay up, and you want to say you've got rest. Your body is crying for you to give it what it needs to heal itself. And
Yeah.
we're not very good at self-care.
Yeah, I used to get up really early and work on a farm, and so I've never been a late person. I married someone that likes being up late, so it's great because she gets up late. She'll stay up late and do things and be productive, and then I'll get up early. So our household is always good because we work at different areas. But I've like I'll go to bed when my kids go to bed. Like I will put them to bed. I'll lay down with them, and then I'll either fall asleep uh, beside them or whatever, and then I'll wake up and go to bed. But I'll go to bed at like whenever I put them to bed, and then I'll get up early if I get up
I
early, and
I love getting up early,
yeah,
and
it's magic.
um, I really like that. And I was so happy when we were growing up, and my mom used to make us go be in bed by 8. Um, and all the other kids were playing outside, and I would grumble, but I'll tell you, I think I was actually relieved.
There's
Um,
nothing after 9 that's like you're just watching TV or whatever. It's like, but in the morning is like I get from 5 till 7. I get most of my day stuff done, and then the rest of it is be a good dad, be a good husband, and play at work. Like that's, but
mhm.
I get all my personal stuff that I need to do for me done between those 2 hours.
Yeah, and what I love about getting up early is, well, I live in a place that I'm surrounded. I live rurally, and so I've got the birds on the back deck, and I go down to the barn, and the donkey's hollering at me to feed her, and that's a magic time for me. And then I'll come in, and maybe if it's the weekend and I'm working on the radio show, I'll get a lot done. By 9:30, I've cranked out a lot, and then I can just enjoy my day.
Yeah, exactly.
Hmm.
Yep, I agree with you. I've always been like that. I love the morning.
Yeah, I mean, yeah, I'm with you there. So, Kevin, we're closing up now. Do you have anything that the listeners need to know?
No, I just think that was a lot of fun.
It
Thanks
is
for
a lot
inviting
of
me.
fun. So,
Yeah.
anybody lives near South Central Pennsylvania, Kevin's office is in State College and also an office in Williamsport,
Yep,
which
hands and
is
health.
kind of north, going up Central PA north. His office is Hands in Health
Yes.
Chiropractic. And if you want a healer and you don't even mind driving, this is the place to go. And if you have an animal that is struggling, I don't know, would you ever do a house call for a horse?
So I used to adjust horses all the time, and then when we had kids, I decided to pass the baton on to a couple other chiropractors. I can refer other chiropractors for horses.
Hmm.
But yeah.
I had my horse had a shoulder problem once anyway.
Oh,
We got a chiropractor. Group of us went in and paid for a chiropractor to come up from West Virginia. So we had, all the horses gathered in the barn, and he went, did the assembly line. But
yeah. Yeah. I used to do that.
cool. All right, we're closing up. Everybody, I'm Doc Martin on Maximum Medicine, here with Dr. Kevin McCarthy about feeling the flow and to be in the flow and follow your intuition. And of course, get your sleep, eat quality food, and be around people that make you happy and animals that make you happy. All right, we're closing up. Thanks for being with us. You've been listening to Maximum Medicine Radio with Doc Martin. Tune in next time while the doc talks health, spirituality, and the impact your beliefs have on every part of who you are, body and soul. Doc Martin unpacks the challenges we face as human beings and teaches callers to open the door between the scientific and the mystical. To learn more about Doc Martin and Maximum Medicine, visit www.sharonmartinmd.com.